Thank you. The U.S. is stuck in the painful throes of one of the worst, longest government shutdowns in our history. Americans are calling out for leaders in the White House and Congress who will cut through the chaos and begin to restore order. Last week, our president played his trump card. In the middle of this shutdown, with health care for 35 million Americans online, or on the line, the president gave a green light to a $40 billion bailout. A $40 billion bailout, I had to read that twice, to Argentina. Yeah, you heard me right. President Trump decided to prop up the far-right agenda in Argentina right before their elections and leave Americans nervous that they're going to be able to afford their health care. Doesn't make a lot of sense. The real gut punch, he did it right as 20 million Americans are bracing for their health care costs to, in many cases, double or more when the ACA premium tax credits expire. Now, think about that for just a moment. Instead of spending $40 billion to lower health care costs for 20 million Americans, President Trump decided that the $40 billion should go to Argentina. That's certainly not America first. Instead of spending $40 billion to make sure that seniors can afford their insulin, cancer patients can continue their chemo, sick kids can see a doctor, President Trump is sending $40 billion to Argentina. $20 billion of that bailout is backed by all of you, the American taxpayer. Trump promised a lower cost for working families, but food prices are up. Electric bills are up, and now health care prices are going to be exploding. It's all because of what the MAGA Republicans and the president are doing. Here's the reality. In July, Republicans passed their budget bill that's going to strip roughly $1 trillion out of Medicaid and the Affordable Care Act. It's the largest cut to health care in the history of this country, the largest cut to health care in American history. It's exploding our national debt by trillions, and it gives pretty lavish tax breaks to some of our largest corporations and some of our wealthiest individuals. As if working families needed another hit, 20 million Americans are going to see their health care premiums double when ACA tax credits expire at the start of the year. On this Saturday, every single American can log online and see the new cost of their premium if they're on the exchange. In Colorado, the Denver Post reported today that premiums will double. And for far too many, this is going to be financially devastating. We're trying to get our arms around the increase that we're going to see in medical bankruptcies. In Colorado, a family of four making a combined $128,000 is going to have to pay $14,000 more for their health care. So they're making $128,000. At the end of the month, they're still trying to make sure they've balanced the household budget. And now they're going to have to spend $14,000 more just on health care. If that family lives on the west slope in Colorado, west of the Rocky Mountain Divide, or whether it's out on the Eastern Plains, they'll pay even more, somewhere between $16,000 and $21,000 in additional premiums. Nobody has that kind of money. I'm not sure why the president doesn't understand that. Small businesses, some with very tight margins already, are going to be forced to choose between insurance or layoffs. Roughly 225,000 Coloradans are in that group that are going to see their premiums double. Double. It's so much more expensive that an estimated 4 million Americans will be priced out of their health care next year, including roughly 75,000 Coloradans. And for those people with pre-existing conditions, boy, that's taking a dangerous hit. And if you think you're safe because you receive insurance through your employer, think again. People are going to continue to get sick regardless of whether or not they have health care. The fact is, of course, that more Americans get sick when they can't afford basic preventative care. That's why they call it preventative care. Here's a startling fact that came out of a Harvard study in 2009. Americans without health insurance on any given year have a 40% higher risk of death than those with insurance in that same given year. I'm going to repeat that. Americans without health insurance have a 40% higher possibility of dying than those with insurance in any given year. The result, when there are fewer insured Americans in the entire system, insurance companies raise premiums on those who do have insurance to make up the shortfall. That means we're all in the same leaky ship. A little over a week ago, I spoke with one of the many Americans who will be impacted, a young woman named Mercedes, who lives in Commerce City, Colorado. Now, Mercedes and her family, U.S. citizens, live in a district represented by Congressman Gabe Evans, who's been a vocal advocate of Trump's budget bill, the same budget bill that's going to cut $1 trillion from Medicaid and the Affordable Care Act. In Representative Evans' district, 1 in 4 Coloradans are on Medicaid, including 86,000 children. 86,000 children, 1 in 4 people on Medicaid. Just over 7 weeks ago, Mercedes' family of 3 became a family of 4. She gave birth, earlier than expected, to a baby girl. Her newborn spent 49 days in the intensive care unit, the NICU, before they were finally able to bring her home last Friday. Doctors diagnosed their baby with a rare disorder that's going to require some level of specialized care for life. Even now at home, their baby still depends on a home health nurse and a feeding tube. So when Mercedes recently opened a letter informing her that her insurance premiums are going to skyrocket once the ACA tax credits expire, it wasn't a function of being frustrated. For her, it was terrifying. Mercedes' premium is already more than $1,000 a month, and it's about to jump even higher. In addition to running their business, caring for their newborn with a fragile health condition, and raising their 7-year-old daughter, Mercedes and her husband now have to worry about their ability to be able to afford health care, to be able to stay on the health care that they have. They have a baby who is fully dependent on expensive hospital care. If their premiums go up, how are they going to afford the NICU bills? What will they have to sacrifice? Will the food take a cut? Will their rent go into arrears? Will they afford their medications? Mercedes doesn't have to go through this. No American should have to go through this. And Mercedes isn't alone. There are 20 million Americans bracing for these types of cuts. 20 million more people, just like Mercedes, who depend on their health care to afford their prescriptions, to keep a roof over their heads, and, importantly, to stay out of the hospital. It doesn't have to be this way. All that the President and the MAGA Republicans have to do is extend the health care tax credits. If they can find $40 billion to send to Argentina, they can almost assuredly find $40 billion to begin to stop premiums from doubling for Mercedes and 20 million Americans. I think we've lost our bearings. We've lost our North Star in this. Healthcare isn't political. It impacts every single one of us, Republican or Democrat, urban or rural, and it often interrupts our lives when we least expect it, especially when we're most unable to afford it. And this problem is easy to solve. Republicans and Democrats can reopen the government today and fix this healthcare crisis. We need to start talking together and have a discussion, but we can work together and reopen the government. Working families want us to take leadership on this. They want us to get back to the issues that they sent us to Congress to solve, to make life better for them and their community, and for us to hold down the costs that are making their lives more difficult. I think we need to listen to Americans. I don't think it's too late, but it's long overdue. Thank you, Mr. President. I yield back the floor.